Welcome to today's presentation brought to you by Power to Practice, 2-Minute Tuesdays, Ordering Controlled Substances with ERX Integration. We'll review each step of the ordering process to help you navigate it with confidence, improve your workflow, and ensure compliance every time. Let's get started. From the patient's summary page in the patient's chart, under Ordering, scroll down and click on Medication. From here, under Details, use the drop-down menu and select Medication ePrescribe. Then, click on Manage Prescription to begin the process of ordering a new medication. Select the ordering prescriber using the drop-down menu, then click Select. If there is no insurance on file or the patient isn't billing insurance, click Use None. The patient can still provide their insurance details directly to the pharmacy. Let's create an order for a controlled substance. Start by selecting an ICD-10 code. Click the small down arrow to choose a previously used code, or use the magnifying glass icon to search for a new one. Search by ICD-10 code or description. When you find the correct diagnosis, click the radio button, then click on Use Selected. The written date automatically becomes the effective date. You can choose to set a different effective date for the medication when necessary. Let's search for a drug or medication. Please note though, you cannot free text the medication's name. Click on the magnifying glass icon to open the search tool. You can choose from previously prescribed medications or search for a new one by name. We will search for testosterone. Then, locate the options labeled bulk and select the appropriate base for the compound. Enter the SIG for the new compound. You can also click the down arrow shown here to choose from previously used signatures. Enter the quantity, days of supply, and the number of refills. Then, select the appropriate unit of measure from the available options using the drop-down menu. Next, enter a note to the pharmacist. This is where you will include instructions on how the medication should be made, any additional compounded ingredients, and the recommended dosage. The Issue To field will display a previously selected pharmacy for the patient. You can also use the down arrow to select from other pharmacies already linked to the patient. If you need to choose a new pharmacy, click the magnifying glass icon to open the search tool. Enter a few identifying details to help find the pharmacy, then click Search to display the results. Please note though, if you can't locate a pharmacy, try adding or removing identifying details. If it still doesn't appear, the pharmacy may not be enrolled with Optum. Only the pharmacy can choose to enroll in ERX through Optum. Once you find the pharmacy, click on the radio button. Then, click Select and Save to Preferences. This will store the pharmacy as a preference for future orders. Then, click Issue. If any DUR warnings appear, this box will display. Click Accept and Return to proceed with the order, or click Close to return to the previous step. If this is your first controlled substance order, you'll be prompted to create a new passphrase. Once created, click the checkbox Ready to Sign, then enter your passphrase. Please note, it's recommended not to autosave your passphrase. Always manually type it in for security. Then click Push to send a push notification for two-factor authentication. A notification will be sent to your smartphone device to approve the two-factor authentication. Scroll down and click on Sign and Transmit. Finally, click on Finished e-prescribing to send the medication electronically. Thank you for joining the Power to Practice 2-Minute Tuesdays presentation on ordering controlled substances with ERX integration. Look out for more 2 Minute Tuesdays coming your way.